Very many thanks, Owain, and I think that just shows why it's always really important to be the second speaker on, not the first speaker on. I'd add my welcome to his. It's really great to see so many people face to face, to be here in Swansea for our annual research conference, and to see the research community turning out in droves to come and join us for today, which is, I think, a day of both celebration and challenge. We publish our annual report today, and I always think when we put out our annual report, it's an exercise both in appreciating what we've achieved and thinking about what more there is to do. I put on the slide a quote from the Minister, Eleanor Morgan, in her foreword to the report, where she talks about the difference the research makes to people's lives and to the health of communities in Wales, but also endorses the plan that we published during this year, trying to set out both what we were doing and our ambitions. And I'm going to take a few moments just to give a little mini State of the Union on where we are with that plan. We were really keen that it was a plan, not a strategy. Strategies sometimes sit on the shelf once they've been written. Plans are things that you say you're going to do, and then people can see whether you've done them. We were also really keen not to gild the lily, to be pretty honest about what we thought were some of the challenges of where we were now, in order to then make more progress. We put an emphasis in the plan on us needing, as a community, to recognise that we can't do everything in research. We need to focus on areas of strength and need here in Wales and set very high expectations for ourselves. Expect Welsh research to be up there competing with the best at a UK and at an international level. And in setting the plan out, I think we were really saying we all need to think about how we can raise our game, including, of course, us, Health and Care Research Wales ourselves. A lot has happened in the last year, and I'm just picking out a couple of things that I think I'm particularly proud of, to be honest. We've produced, with the community and with boards and trusts in particular, the R&D framework, which is on our website, and it's a really clear articulation of what excellent research looks like in NHS organisations, where it's really embedded in the mainstream of what the organisation does, which I don't need to tell you, at this time, with the profound challenges that NHS services are facing, is a really hard thing to do. And we're now using that with every board and trust in our engagements and dialogues and reviews. I think one of the most transformative things in the long term we've been trying to do is to improve the opportunities for research careers here in Wales, to enable people to come to Wales to have a really productive research career, to progress from PhD through to being a principal investigator and a research leader and a professor, and to have opportunities across that span. And the work of the Health and Care Research Wales faculty, which we set up this year and which Monica Bussey is talking about later today, is absolutely central to that. And I think we've already come a long way in changing those opportunities. We've made a signal investment in adult social care research, where there's a huge research need in Wales. There's a lot of resource available going into adult social care research right across the UK. And after a competitive process, we invested partnering with Cardiff University in a new centre which has just launched. We learnt a lot during the pandemic about trying to mobilise research to help people to answer questions that needed to be answered quickly. And we've taken that work forward with that team into the new Health and Care Research Wales Evidence Centre, which is working right across the NHS and in Welsh Government, and I think is really important in demonstrating to the people who fund research in Welsh Government and elsewhere how research can really make a difference. We saw that in huge terms during the pandemic. We need to keep showing that. And other things we've changed, we've improved our funding schemes, and importantly, we've negotiated much fuller access for Welsh researchers to the schemes we contribute to in the National Institute of Health Research in England. So there's a lot more opportunity for this community to get out there and apply for more research money. There's lots still to do. We're undertaking a review of clinical research delivery at the moment, where we really have to ask ourselves some tough questions about what we can do to improve the value for money we get out of the, getting on for £19 million a year we spend on delivering clinical research in the NHS. We are also reviewing our infrastructure investments in centres and units, looking at how we can help them to take opportunities and use our resource to support a much larger programme of research. We're going to be in 2024 making some new catalytic investments like that one in social care in partnership with universities and other stakeholders in areas where we think there's real promise. There's lots to do around using data for research. I could talk about that just for hours. SAIL is a fantastic Welsh asset, and Wales has been ahead of the game in the UK in using data for research, and we need to think about how we maintain that competitive advantage. And there's a lot going on at a UK level. You'll have seen headlines about the Moderna and BioNTech deals, the UK life sciences vision, and in all of that, we need to be on the front foot in getting the best deal for Wales. So lots still to do. I want to finish by saying I was in a meeting yesterday where people were talking about infrastructure, and one person had a view that infrastructure was kind of labs and machines and things like that. Someone else said, no, the most important part of our infrastructure is the people. It's the people who are really what makes a difference to our research performance and capacity and capability. And this is another quote from Eleanor's forward to our annual report, and I think it's a really important acknowledgement that what we achieve in health and care research is really about the community of people, not just the researchers, but the clinicians, the people in health boards and trusts, in social care organisations, the research nurses, the support and delivery staff, the patients and members of the public who get involved in our research, and that's what makes research make a difference for people and communities in Wales. So thank you very much for coming to the conference. It looks like a really great day, and I'll hand back to Owain.